I'm a consultant to Ocular Therapeutics.
Hi, I'm John Hovanesian. If you're a cataract surgeon, whether you create corneal wounds with a diamond or metal blade or a femtosecond laser, every incision is a little different, and not all of them are going to seal perfectly after surgery. While suturing incisions has long been the gold standard method of closure for a leaky wound, there are a number of advantages to a hydrogel sealant, including comfort for the patient, not needing to remove a suture afterwards, and not having a potential nidus for infection. In fact, a controlled FDA study comparing suture to a hydrogel sealant showed the sealant was actually superior to sutures for prevention of wound leakage under the kinds of mechanical challenges that a corneal wound might be exposed to after surgery. And for that reason, it's appropriate for every cataract surgeon to be familiar with applying sealants, so you're ready in case you need to use this material in appropriate cases. This video will review techniques for using a hydrogel sealant in cataract surgery. We'll also discuss the kinds of patients where a sealant might be of particular value. First, the only hydrogel sealant that's available in the U.S. is called Resure. It's made by Ocular Therapeutics in Bedford, Massachusetts. It's provided in a dry form with two wells in a small sterile tray that contains a white deposit in one, that's polyethylene glycol, and a blue cross-linking agent in the other, and that'll help provide polymerization. The company gives you two applications in each kit in case one isn't enough to get the wound sealed. The kit also contains a dropper bottle of diluent, very similar to BSS, that's used to reconstitute the hydrogel. The hydrogel is placed on the eye in a liquid form, and it polymerizes over about 30 seconds to a soft gel that has the consistency of a contact lens. It adheres well to the corneal and conjunctival surfaces, so it's really well suited to hold leaking wounds fluids inside, even when the eye is fairly highly pressurized. Now, the hydrogel will slough off or melt away as the wound is reepithelialized, so it's typically gone in 4 to 5 days. It's important to make sure the corneal wound is fairly dry and not actually leaking when you apply the sealant. Otherwise, escaping anterior chamber fluid will dilute the hydrogel before it's able to polymerize on the ocular surface. Applying the sealant to a dry wound involves a little bit of timing. Once you've got the area around the incision dry, apply 2 drops of the liquid diluent to the blue activator well, and then mix the activator with the hydrogel sealant using the provided applicator stick for an informal count of about 5 seconds. Next, take the foam tip of the applicator and gently, without distorting the wound, apply the hydrogel over the entire outside of the wound, extending at least 1 millimeter beyond the wound on all sides. Be sure to remove the applicator by around 11 seconds so the polymerizing gel doesn't stick to the applicator as you pull it away from the eye. A good way to remember this is to think 5, 7, 11. Mix for 5 seconds, start applying to the wound by 7 seconds, and be off the eye by around 11 seconds. The hydrogel will polymerize in about 30 seconds, so it's best not to take out the lid speculum or apply drops or distort the wound for a little while after the surgery is completed, after the application of the sealant. By the way, that blue color disappears about an hour after surgery, so the hydrogel becomes essentially invisible to the patient or someone casually looking at the eye after surgery. There are a few ways to stop fluid egress from an actively leaking wound. When stromal hydration isn't enough to create a dry surface, it may help to depressurize the eye after stromal hydration to stop a persistent leak. You can also use a blunt instrument to tamponade the wound closed by putting a little bit of pressure on the cornea just central to the internal wound opening. What this does is close the wound temporarily, and it allows you to apply the sealant over the exterior of the wound. You want to keep that external pressure there until the hydrogel polymerizes, maybe 30 seconds or so. By the way, when you're using the applicator, the foam tip can be used as well to mix and apply the sealant to the eye. Here are a couple of examples of cases that might benefit from a hydrogel sealant. Here's a case with crystal lens, where sealing the wound definitively will prevent wound leaks that might allow the lens to vault forward, resulting in an unintended myopic result. On these cases, it might make sense to use the second application for the side port incision, which also can leak after surgery. Don't worry, by the way, if there's a little runoff of the sealant into the fornix. That can carefully be wiped away later. Just make sure the incision itself is well covered. In patients with small pupils, especially those with pseudoexfoliation like this patient, the iris can be captured in the wound if there's significant leaking after surgery, so sealing the wound will prevent this. Patients receiving a glaucoma stent like the eye stent can develop hyphema if there's significant hypotony from a wound leak after surgery, so it might make sense to seal these wounds to maintain a consistent intraocular pressure after surgery. Other cases you might consider for wound sealing might be anytime there's vitreous loss, or if there's a wound gape that's visible either internally or externally. Phaco burns, or patients maybe who might be prone to rub their eye after surgery and not follow directions. In particularly challenging cases like wound burns, you might also combine a suture with the sealant. Each material has its own strengths. Sutures provide tense mechanical wound compression, while a sealant can close a gap between areas of suture compression to keep an otherwise impossible wound leak-proof. First, if you're going to do this, place your sutures as if you weren't planning to use any sealant. Then get the surface as dry as you can by the methods we talked about. And third, place the sealant over the entire wound. I hope this video is helpful to you in learning how to use hydrogel sealant to close cataract incisions. I'm John Hovanesian. Thanks for watching.